Panorama started doing virtual visits or telehealth about a year ago. So in 2019, a couple of our providers started trialing it, especially for patients that were coming from a longer distance. It was a really valuable tool to interface and video and discuss with patients their care, especially when they were coming from multiple hour drives away. Then in this past few months, we've ramped up to all the providers at Panorama providing virtual visits for patients, and this is allowing patients to stay in the comfort and safety of their home and be able to interface with their physician and have their care visit provided that way. As a physician at Panorama, virtual visits have been really valuable in my efforts to provide care for patients. Now having the ability to see the patient on a screen has been incredible for me to see the patient and the way they react to the information I'm providing to them. And so understanding how the patient's receiving that information has allowed me to interface with them better and answer questions, maybe guess when they have questions that they're not really telling me on a simple phone call. In addition, the software that we have allows us to show our patients the films. So I've been able to show them their x-rays. In my case, I do spine surgery, but specifically I do scoliosis. And being able to show curvature on a film to patients is vastly better than trying to describe it on a phone call. So there have been some really obvious advantages to doing virtual visits and some that you wouldn't really think of that have been pretty profound. Right now, we want patients being able to stay safe and at home, and clearly being able to do a virtual visit allows us to do that. One of the nice things with virtual visits between myself and the patient is how much I've been able to stay focused on what they're telling me. And being able to use the screen and interface with the patient has been really focusing for both me and the patient on what the condition is, what we're talking about, and has really avoided some of the external distractions that can take away from our visit. Some of the other advantages have been avoiding wait times. Patient visits are starting right on time, interestingly enough. My 8:15 visits are starting efficiently. They already have their imaging done ahead of time, so we're not wasting time with the patients in the waiting room, going over to x-rays, changing into a gown. All of that's been accomplished so that when we're starting the visit, working through the visit and discussing healthcare with our patients, we've really avoided some of the extra time that patients have been spending in physician offices that are unnecessary. Getting started with telehealth or virtual visits has been relatively straightforward. It starts with just having an email address, and our software will send you an email and allow you to accept the software and the application, allowing it to accept access to your video camera and the microphone. And then the visit has gone very smoothly from there. I've had a very good response from patients in terms of the quality of the audio, their ability to hear me, to see me, and then again we've been able to go over images and such at the same time. You can do this on a smartphone, you can do this on an iPad, laptop, or a desktop computer. All you need is a microphone and a camera, which again most smartphones and iPads this is going to work well. So one of the concerns that patients often have when it comes to doing an online or virtual visit is, am I really going to be able to examine them and understand what's their diagnosis and what's causing their pain? We've been able to do this very well with the quality of the video. I've been able to, for myself as a spine surgeon, have patients show me the location of their pain, show me the strength in their legs. I've been able to do a neuro exam and identify lack of sensation or motor strength in their legs. It's been a little trickier than doing it in person and being able to lay my hands on the patient, but we have figured out good ways to come to what are the different issues the patients are having that they're coming to me for. And I've been able to arise to the diagnosis and order appropriate imaging and then evaluate that imaging despite some of the limitations of my ability to examine patients on a virtual visit. One of the things we've found helpful during virtual visits is that the camera is not being held by the patient so that it's leaning up against a book or a desktop computer, and then I'm asking patients to get up and move away from the camera so I get a wider picture and they can show me where their symptoms are coming from, and being able to check a neurologic examination, comfortable loose clothing has been no problem. Despite all the benefits of being able to perform these virtual visits, once in a while there's still the need to bring a patient into the office, whether it's for appropriate x-ray imaging or for me really to get a feel for their exam or any looseness of a joint. We still are asking patients to come in for a physical visit occasionally, and a lot of what we've accomplished on the virtual visit can make that visit even more efficient, and we have a few things to focus on. but it certainly happens occasionally that we're bringing folks into the office.